Hello, physicians and nurses from Hospital XYZ. I'd like to thank you for the opportunity of inviting me in to show you the advantages of using Venaflow Elite for DVT prophylaxis with your surgical as well as non-surgical patients that you care for in your hospital. I'd like to start off by first allowing you to touch and feel the difference of our cuffs that attach to our SCD device. One of the comments that we usually get right off is that they're a lot softer, and that's true, and that's by design. One of the complaints we've heard from you guys about the previous device that you used was that with the cuffs, the patients complained about being hot and uncomfortable, and you also said that some of the patients actually suffered from skin breakdown also because of that discomfort associated with the heat and movement of the cuffs. So these particular cuffs and the way we've designed them go a long way towards helping with A, patient comfort for you guys, and also B, potentially patient compliance, because the patients will not wear them, don't want to wear them if they're uncomfortable, and they usually take them off themselves or ask you guys to remove them, and they end up hanging off the side of the bed. So these particular cuffs, because of the comfort, allows them to help you guys with patient compliance as well as comfort. Okay, and just to show you, this is our universal size calf cuff. We also have calf cuffs, foot cuffs, as well as thigh cuffs that all run off this same machine. This is the universal size. This will fit approximately 85 to 90% of your patient population. We also have extra large as well as bariatric for your different size patients' needs. So you have different size patients, we have different size cuffs. This will accommodate the vast majority of them. If you have a patient that has a smaller leg, then you just cut it to fit on the material side of the cuff, and as long as you leave enough material for the Velcro to adhere to, you'll be fine. So you can accommodate a smaller leg patient also. Okay. Now we'll go ahead through and show you how to attach the cuff. We recommend that you start out with the bladder of the cuff on the posterior portion of the calf as such, and we apply it snug but not tight. Okay. And we recommend the posterior portion of the calf because then everything is neat and tidy and out of your way. The tubing is exposed down the back of the ankle. But if for any reason during a procedure or during recovery, if your patients are complaining about movement and trying to sleep, or if during a procedure movement is a problem with the procedure, you can also rotate this bladder of the cuff to the anterior portion of the calf or the lateral portion of the calf, and it'll still have the same efficacy, the same mechanism of action, no matter where it's located on the leg. But it gives you some flexibility and configuration in terms of where you can push or put this particular calf cuff. Okay. Now we'll show you how to attach it to the machine. This is the standard tubing that comes with the Venaflow Elite. Very easy to prepare. It's two male ends that come out of the tubing. You just snap them right into the female receptacle of the machine here, and they snap in very easily. And we also have different length tubing depending on the configuration of your OR or your recovery room. So we have different size tubing if you need longer tubing or shorter tubing or standard tubing. Okay. Let's go ahead and attach the tubing to the cuffs. Again, the tube has a male end to it, and it just attaches very nicely to the end of the tubing and the female end, as such. Now, just to go over some of the benefits or features of this particular piece of equipment. We have a telescoping bed hanger, so you press in this button and pull out the bed hanger up to 3 inches. So it fits very nicely on all the beds that we retrofitted as we went through the hospital, so it fits on all the beds and all the different units. So you push this button, pull it out, and then just tap it to fit. It has interlocking teeth, which allows it to lock in place. So it fits very nice and tidy on all the beds in the hospital. Whether you like to put it on the footboard, headboard, or even on the side rails, depending on the configuration and where the piece of equipment is likely to be housed in that particular patient's room or procedure. Alright, now let's get you familiar with the machine and how to use it. The middle button here is the power button. Now you turn that on, and right now what the machine is doing is going through diagnostic mode. Right now it's adjusting the pressures automatically. It's also determining whether we have foot cuffs, calf cuffs, or thigh cuffs on this particular machine. Alright, now after it's finished, you see this little diamond here. The diamond represents that it's still in ramp up or diagnostic mode, as we would call it. Now this particular machine has a compliance counter on it, which allows you to log patient hours if need be. DVT prophylaxis is a very hot button in a lot of institutions these days, so DVT prophylaxis is towards the top of that list. This allows you, if you have different DVT initiatives in place at your hospital, to log patient hours very easily, because it's always counting, and the way you reset it is just hit this button and you start over from where you started from. Okay, so you're always allowed to, or always able to, record patient hours on this machine. Another cool feature about this machine is you can do single or dual leg compression. Okay, in the past we've heard that you guys had to do a towel wrap with some of these machines before and still had to hook up both cuffs and then put it under the bed. No longer do you have to do that. Within the first 3 minutes of turning it on, when it's still in diagnostic mode, as denoted by this particular diamond right here, you hit this button and it goes to single leg. So one of the legs go away on the screen. Now it's in single leg compression. So if you have an amputee or someone you've done a vascular procedure on and you want to do compression on single leg, this particular piece of equipment will allow you to do so. Alright, now we'll hit the button to go back to dual leg, because the machine defers to dual leg compression. So if you do nothing, the machine will compress 2 legs if you hit no buttons. If you want to do single leg compression within the first 3 minutes, you push this button and make it go to single leg compression. Now if for some reason you missed that 3-minute window of opportunity to hit single leg compression, you simply turn the machine on, or excuse me, off, and turn it back on so it restarts in diagnostic mode, and hit the single leg compression button within that first 3 minutes. Okay. Now I would like to take you through some of the potential alarms that you could hear with this machine and show you how to deal with them. 3 potential alarms that you would hear with this particular machine, and the way you know is because these particular green lights here would turn red on top and give you a visual as well as an audible display of what the particular alarm is. Those 3 alarms could be one, if the tube becomes kinked or has a hole in it, an alarm will sound after 3 minutes, or approximately 3 minutes. The second alarm you could potentially hear is if there's a discrepancy between the amount of cuffs that we actually have connected and what we see on the screen. So say, as for instance, if we have 1 cuff connected, but the screen shows we should have 2, an alarm will go off. Okay, a leg alarm will go off. And thirdly, a service alarm. If one of the inner working mechanisms of the machine are kind of thrown off and it needs to be sent down to SPD, we'll either coordinate with them to repair or replace it so that you guys always have working newer machines in your particular unit. Okay? Now, just to tell you how to deal with the problem, if an alarm comes up and you hear it as well as see it going off, you first of all recognize the problem, which it says right on the screen. Second of all, you solve the problem while the alarm is going off. And then thirdly, you just tap, not press, but tap the power button, and it'll go right back to where it started from without going back through ramp up mode, as in you turned it on, you turned it off. So those are the steps to dealing with the alarm. You recognize the problem, fix the problem if you can, which you might have to reattach the tube or reattach a cuff or do one of those deals. And if you do that, you tap this button and it goes right back to where it started from without you having to reset the whole system. So do you guys have any questions, concerns, or comments for me that I can answer? Thank you.